Hello, my name is Charlene McCordic, and this is my verbal case study presentation on dyspnea. SS is a 30-year-old female who presents to the clinic with a 2-week history of cold and cough-like symptoms, and she's had shortness of breath for the past 5 days that has progressively worsened. This is her chief complaint. The patient reports getting a cold 2 weeks ago with an accompanying dry cough, and that the illness has persisted for the past 2 weeks and doesn't seem to be resolving. She states that the dry cough that was accompanied by fatigue, but now the cough has progressed and worsened. The cough is now productive with yellow-green sputum, and the cough is quite frequent, enough to disrupt what she's doing. She has reported to missing several days at work, where she stayed home and attempted to rest her body. She reports having a decreased appetite and has been trying to drink fluids, but even that seems to be difficult as her body doesn't feel like it needs or wants anything. 5 days ago, she noticed that her shortness of breath was getting worse, and she was even getting short of breath just walking to work. The shortness of breath has continued to worsen, and she reports that it's now difficult to even walk up the short flight of stairs into her apartment. She reports like she's feeling like she's gasping for air or like trying to find air once she exerts herself, and something simple as walking up the stairs causes her to need to rest for quite a few moments just to regain her breath. Aggravating factors are obviously physical activity and coughing. Relieving factors would be rest or lack of physical activity. And with regards to timing, it's not affected by time of day. The symptoms are essentially the same morning, afternoon, evening. Other associated symptoms that the patient reports are a fever. She hasn't measured it and doesn't have a number value, but states that she feels quite warm at times, and then she also has been experiencing chills that come and go with no real pattern. She denies nausea and vomiting. She denies a headache, and as previously mentioned, a lack of appetite has also been experienced. She reports that the amount of sputum that comes out with each coughing spell is about the size of a quarter. And she's been taking some cough syrup just over the counter, which seems to relieve the cough for a short amount of time, as well as ibuprofen, which relieves the fever and in consequence the chills. However, the fever and chills consistently come back. In terms of medical history, she reports that she's otherwise healthy and has no medical conditions, and that she hasn't experienced signs or symptoms to this degree before. She works as a secretary at a nearby medical office. She lives on her own, and despite being exposed to ill patients who come into the clinic, she reports that her immune system is strong and she doesn't get sick very easily or very often. She denies any recent travel, and she denies any contact with other animals except her personal dog. She reports that she's fully immunized up to date, and that her family has no medical history that's pertinent to the symptoms that she's presenting to the clinic today. She reports having seasonal allergies just to pollen, but no allergies to any medications. She does not smoke. She does not take any recreational drugs. And with respect to alcohol, she might have 3 or 4 drinks per week if there's any social events going on. Medications that she does take: a less birth control on a daily basis, and as well as vitamin D and iron supplements, which she gets from the health food store. And she's regularly active. She reports going to the gym about 3 times a week and walking her dog every day. So on physical exam, she is tachycardic. Her heart rate is 100. Her radial pulses are strong and regular when palpated. Her cap refill is normal and brisk. When She's febrile, her temperature's 38 orally, and her blood pressure is normal, 115 on 60. In appearance, she's pale. She doesn't have any circummoral or nail bud cyanosis. She is diaphoretic. She's tachypnic. Her respirate is 20. She's got slightly labored respirations, and there are some audible breath sounds heard, a slight crackle when walking in the room and listening to her breathe. On inspection, there's no deformities, no asymmetries noted. Her anterior and posterior, as well as lateral chest diameter, appear to be normal. She denies any chest pain. She does have visible work of breathing. Her accessory muscles are being used, as well as she does have some intercostal retractions. There's no tracheal deviation. On palpation, there's no tenderness noted, posterior or anterior. She's got normal chest expansion bilaterally, posterior anterior, about 2 centimeters. And when tactile ephemeris was checked, it is more pronounced the left lower lobe. It's otherwise normal throughout the rest of the lung fields. On percussion, the lungs are resonant throughout. However, there is noted dullness to the left lower lobe, both posterior and anterior. And her diaphragmatic excursion appears normal posteriorly, about 4 centimeters. On auscultation, she does have crackles to the left middle lobe with decreased breath sounds to the left lower lobe. Otherwise, across the rest of her chest, her respirations and air entry appear normal. Bronchophony, when checked, reveals clear words to the left middle and left lower lobe, and then they're muffled throughout the rest of the lung fields. While I was palpating, I checked the lymph nodes of the neck, no tenderness on palpation. When palpating the heart, there was no heaves, thrills, or lifts present. And when auscultating the chest, I also took the opportunity to listen to her heart, which on auscultation, I hear strong S1, S2 to aortic, pulmonic, tricuspid, and mitral areas. There's no extra heart sounds, and there's no murmurs noted. And as mentioned before, her cap refill is normal. So in summary, SS is a 30-year-old female who's been experiencing shortness of breath that has progressively worsened over the past 5 days. She now has a productive cough with moderate yellow-green sputum. She's tachypnic, tachycardic, and febrile. Her chest reveals decreased air entry to the left, middle, and lower lobes with crackles on auscultation. So the diagnosis suggests a left lower lobe pneumonia, but further diagnostics and testing will need to be done to confirm. Thank you for listening to my verbal case study presentation.